Many people know me for coining the phrase Snapchat dysmorphia or selfie dysmorphia. And it was a phenomenon I described, which I noticed first in my clinic. But when I started speaking to more and more of my colleagues, they were noticing the same thing within their practices. And this wasn't just within the UK, this ended up being worldwide. What I was noticing was usually before, way back, patients would bring in pictures of celebrities we're talking about 10 years ago, of what they wanted to look like. And really this was to help them articulate what they liked. So it may be Angelina Jolie's jawline or someone else's nose. And it helped them give them a way of describing what they needed to the physician, which was okay. What then I started noticing were people were using altered and filtered versions of themselves, which again, in a way, if it's just to give a starting point or a way to articulate what they could have, then that's okay because it acts as a reference point. But for a small percentage of patients, I started noticing they wanted to look exactly like that image. And that image is an unrealistic image to be obtainable and was concerned. And in many ways, it had ideals with many mental health disorders that you do see within the NHS and the private sector. When looking at someone, if they do or do not have selfie dysmorphia, the key characteristic I think is that they do prefer, one, how they look on social platforms rather than in real life. Two, they are obtaining treatments to make them look like they do and appear in their filtered or altered images that they do when they use these platforms. And three, that they're not aware that this is an unrealistic expectation and they're continually going to get these treatments, often disappointed because no doctor, no physician will be able to produce that image that they're trying to obtain. When I see a patient that comes in and I'm very concerned or they have red flags that look like to me like Snapchat dysmorphia or selfie dysmorphia, one of the key things is to try and counsel that patient. One, to explain why these images or what they want to achieve is unrealistic, and also to delve further in their past medical history of any previous problems, of any mental health problems or histories that are related to that. The key part from that is hopefully an agreement which leads on to counseling, because for that type of patient, what they want is not going to be found at the end of a needle, a laser, or a scalpel. It's going to be found by the right it's going to be found by the right counseling, by the right practitioner. Some of the requests that relate to people wanting to look like their Snapchat filters or altered images are sometimes within the realms of normal. So I want really great skin, or I want bigger lips. But one of the strangest I had was a patient who really wanted bigger eyes, like the actual filter had given. It wasn't possible to give her bigger eyes, and I tried to explain many times why surgically and non-surgically this could not happen. And for that patient, luckily there was a realization that this wasn't something that could be achieved, but the concern was that, in that moment, they wanted to do anything possible to achieve it. I think only hopefully by identifying this trend and then having more and more people research and seeing the reasons behind, therefore we can look at solutions to treating this just as we treat other mental health disorders.